Hey guys, this is Dr. Nick with the Springfield Wellness Center. This week we're going to be talking about bulge discs and what you can do about them. So bulge discs are a pretty common problem. A lot of people will refer to them as slip discs. You may get a diagnosis from your doctor as a degenerative disc disease, which can lead to bulge discs. And so we're going to talk today about what exactly they are and what you can do. So a normal healthy disc looks like this, to where there's a nucleus on the inside and there are fibers that surround the nucleus that hold it in place. As long as this is healthy and hydrated, this will look a lot like this. And the way that the discs stay healthy and hydrated is through motion in the joints. So each one of these discs correlates with a joint in the spine. So if this joint is moving well, the disc is able to suck in nutrition from the outside and get the hydration that it needs. When these joints stop moving for whatever reason, if they get out of alignment, if they get stuck, and those can be caused by a fall, an accident, sitting at work, sleeping on it wrong, lots of different things. So if this gets stuck, the disc is not able, because it doesn't have its own blood supply, isn't able to suck in the nutrition that it needs from the outside. And that's a process called imbibition. So when these get stuck, that's why chiropractic is so important, to make sure that the motion remains. But when those get stuck, the disc starts to dehydrate and it starts to shrink. When it starts to dehydrate, these fibers that surround the nucleus become more fragile and are more apt to tearing. When they tear, the nucleus takes the path of least resistance, because it's a gelatinous material. It takes the path of least resistance and it heads towards the outside. When we lean forward, the nucleus pushes back. So normally when people bulge a disc, they bulge the disc backwards. Now, if it gets bad enough, it can actually bulge outside of the space the disc is supposed to take and hit the nerve. And that's when you start to feel pain. You can have the worst looking discs or back in the world, but if something isn't hitting that nerve, you aren't going to feel it and it's not going to cause you pain. So the function can be missing long before the feeling actually starts to feel bad. What we don't want is for it to progress and turn into a herniation. When the herniation happens, it means that the fibers are completely torn and the nucleus comes outside of the disc. And when that happens, that nucleus really sits on that nerve and it can create an immense amount of pain that is kind of unrelenting. So with bulge discs, you normally have more back pain and you'll start to have sciatic pain. With a herniation, it relieves the pressure in the back, but that nerve that gets hit will run down your leg, depending on what level the herniation is at. So that's what we don't want to happen, because it's a whole lot harder to treat that than the bulge. So the three things we're going to be talking about today in terms of treatment are going to be the three structures that we look at in the office. So the joints are going to be really important. Like I said, the mobility is key to the disc staying healthy and hydrated. The discs themselves, we have a table in the office that helps to decompress discs to where it can help to relieve some of the tension and possibly pull the bulging back into its normal space. And then we'll talk about the muscles, the massage and the exercise that should be being done when you're treating a disc. So the way that we address the joint issue in a bulge disc is one of three different ways. Depending on the pain levels that the patients are in, we have three different options for adjusting. The lowest being the activator, which is the least amount of force. The second being our table that actually drops underneath the patient and it allows us not to put as much force into the patient with our hands. And then the third is going to be a regular manual adjustment, and we'll put Brooke on her side and we'll show you how to do that. So depending on the patient's age, their pain levels, and what we find in the exam will determine what's going to be the best way to adjust the problem. So first, with the activator, basically what we'd be looking for are any misalignments in the spine. So we find any areas might be a little bit out of alignment. Again, those misalignments or the inappropriate motion in the joints themselves, that can lead to problems in the disc. So we find those misalignments, we put the activator in, and it's just a real simple adjustment, and it helps to gently move that vertebra back into alignment. With the drop table, what we would do is we'd be looking at their pelvis and then also their low back again. This again lets us put less force into the body. Same in the low back. Okay. And then for a manual adjustment, we'd have Brooke lay on the right side for me. So this is going to get the most motion into the joints, and it's usually the most effective, but sometimes people aren't able to deal with a full manual adjustment when they're in a lot of pain. So scoot a little bit closer this time. I'm going to bend your knee here, straighten this leg out here. And relax your belly. And so nice and easy, got good motion there. So that's what we'll be looking for with the adjustment with a bulge disc. So the next thing that we're going to be talking about is what we do for the disc itself, which is our decompression table, and then we'll be looking at the muscles after that. So the biggest piece of equipment that we have to address the disc itself is going to be our decompression table. So our decompression table works like this. We have a machine at the end of the table. Brooke is strapped in around the waist, then she has some blocks underneath her arms that keeps her from sliding down the table. This table unlocks underneath, and so this can actually open and close. What happens is the machine will pull for a couple of minutes, and then it'll release for a couple of minutes. It'll pull for a couple of minutes and release for a couple of minutes. That back and forth motion actually starts to create a negative pressure inside of the disc, and it can start to pull the disc away from the nerve. So the joints are going to help to get things moving again so that we can get the nutrition and the hydration back into the disc and they can start to heal. And then this is going to actually help to try to move that disc away from the nerve. So this is going to be addressing the disc itself. So if we're just doing the adjustments, it will be effective. It does help. But adding the adjustments in with the decompression is going to be a lot more useful over the course of time.
Extension of the spine will help bring oxygen. Hi, this is Nancy Thompson, the Functional Fitness Specialist at the Springfield Wellness Center, bringing you this week's Fitbit regarding bulging discs. I'm going to share with you 3 exercises we borrow from yoga that will help you strengthen your spine, stabilize your spine, and mobilize your spine to help relieve bulging disc pain. The first one is a Cobra or Mackenzie push-up. We're going to get down on the mat and carefully come down and bring your hips and your hands and the tops of your feet to the floor. And then we'll take our hands, fingers spread wide, maybe shoulder width or wider, shoulder high, and just press up, inhaling, keeping our hips on the floor as far as you can without any pain. And then we'll exhale, release that, move down. This is extending the spine in a nice safe way. Inhaling, we're going to keep the hips down, raise the shoulders up, and then exhale as we lower down. We want to inhale up, release the glutes and the core muscles as we exhale down. So we'll want to do that 10 times every day. In fact, you could do that 10 times twice a day, and that wouldn't be too much. The next exercise we're going to do for the bulging disc is getting now on our back side in a safe way. Reclining with our feet flat, our back flat, and our head in a nice neutral position so our ears are in line with our shoulders. We want to have our feet hips width apart. We're going to exhale and tilt the pelvis and lift the hips up so that hopefully we can find a line from our shoulders through our knees, a nice straight line. We're going to stay here for about 10 breaths, engaging the glutes, the back of the legs, and some of the core to help again stabilize the spine. And we'll come down, and we can do that 3 to 5 times, staying in it each time for 10 breaths. And then the third exercise we're going to do is a nice stretch where we'll have our arms out to the sides in a cross position. We'll bring, if your back is really tender and you're experiencing discomfort, we'll want to leave the feet on the floor and let the knees, lower the knees to the left, and stay in this position, in a twisted position for 3 to 5 breaths. And if it hurts to have your legs to the side, we can bring a block or something underneath your thigh to help support. And then we're going to exhale and bring the knees to the other side and stay there for the same length of time. And that's a nice lower back stretch. that will help relieve discomfort in the lower back and help mobilize and stretch those muscles that are need to be activated to help relieve the bulging discs. So if you found these exercises helpful or handy, in fact they should be done daily to help relieve bulging disc discomfort and pain, but if you found them to be helpful or handy, why don't you share this with your friends, because friends help friends have a strong core and a healthy spine. This is Nancy Thompson with your Fitbit about bulging discs, wishing you peace and wellness.
So the third most important thing when treating a disc issue is addressing the muscles. So there's two ways that we're going to address the muscles here in the office. One is with massage. So therapeutic massage is going to really be able to get in there with those muscles that are straining and protecting that area, helping relieve those as we're adjusting and doing the decompression. Can help the adjustments be more effective and allow those discs to move more than they would without it. But more importantly is going to be the exercises. So Nancy and her Fitbit showed some stretches that can be done. It's really important with disc issues to make sure that you're getting good extension in your low back, that you're sitting in the proper way, that you're standing up the proper way, you're lifting the proper way. And so that's what's nice about our office, is that we're able to bring you over here into the gym and have you work with Nancy on the proper ways to do things. But the exercises are going to be really important, and your doctor will work hand in hand with Nancy to make sure that the exercises are specifically what you need for your problem. But strengthening that low back area, getting an extension into the spine, and then also strengthening the core muscles are going to help stabilize that area and allow it to heal more a lot quicker. If you found this information interesting, make sure that you like the post or possibly share it with someone if you know anyone that's dealing with a bulge disc or degenerative disc disease. If you yourself are suffering from a bulge disc, make sure you give us a call and get a consultation with one of our doctors to see what your options are. A lot of times people think that surgery is the only option for that, and you want to make sure you exhaust all conservative options before you head down that surgery road. So give us a call at 726-0422 or visit us over at wellnessspringfield.com to find out more information.
To find out more about the Springfield Wellness Center and all the other services we offer, head over to our Facebook page or check out our YouTube channel.